Hi everyone, I welcome you all to another episode of Let's Talk Health. So today we have with us Dr. Banu Teja, consultant urologist and andrologist at Citizens Hospital, Hyderabad. So today we are going to have a discussion about the topic urethral stricture. Good evening, doctor.
Great.
Thank you for joining us. Before we start with the questions, I would like to share your expertise with our viewers.
Hello everyone, I am Dr. Banu Teja Reddy, consultant urologist and microsurgical andrologist at Citizens Specialty Hospital, Nallagandla, Hyderabad. So I am specialized into all the endourological procedures which deals with lasers, endoscopy, kidney stones, urethral strictures, prostate. Along with that, I do lots of laparoscopy and robotic work. Along with, I am specialized into andrology work, which includes treatment of male infertility and sexual dysfunction.
Yes, sir. So we'll start with the question. So what is a urethral stricture?
So to understand urethral stricture, first we need to know what is urethra. We need to know what is the anatomy of urethra. So urethra is an organ which is present in the penis in males and as a part of below the bladder in the females, which connects the bladder to the external surface and which transports urine out of the bladder externally. So this is the urethra. So any narrowing in anywhere in the urethra is called urethral stricture.
So what are the common causes of urethral stricture?
So the general causes which we usually see are those like infections or there is inflammation. Inflammation is any infection caused through this urethral layer, which in turn produces a reaction and causes narrowing of the urethra. This is the most common cause. We also see some strictures because of some injury or some accident or trauma, which is associated with other pelvic bone injuries or some injury which occurs while there is wrong method of catheterization of the bladder.
What could be the symptoms of a urethral stricture?
So the common symptoms which we see in these patients are narrow urine stream, frequency. They tend to take long time to pass urine. They tend to have pain while passing urine, and some of them strain to pass urine. There might be some dribbling of urine in the form of drops. There can be little blood in the urine. So all these are the symptoms which are commonly seen in urethral stricture patients.
So how can we diagnose the urethral stricture?
So this is a very important question. So urethral stricture, first we need to, we'll see a patient clinically, examine if there is any narrowing of the urinary opening outside. After a proper thorough examination, then we need to do some basic tests like ultrasound scanning of the abdomen and to check how the bladder is, how much of the urine is being left inside the bladder. Then we do a urine test to see if there is any associated infection along with it. Then we do a important test called uroflowmetry, which is also like a urine speed test, whether we'll assess the flow, how is the patient passing, how is the stream of the urine. And then there is one important X-ray that is called as retrograde ureterogram, which is used to see the urethral passage. If there is any narrowing, we'll get to know it with this X-ray. So these are the common and very important tests which are needed to diagnose urethral stricture. And especially in females who have a very short urethra, they need a special test along with these routine tests called micturating cystourethrogram.
So what are treatment options that are available for urethral stricture?
So the treatment options for urethral strictures include endoscopic procedures as well as open procedures. So endoscopic procedures play a major role, especially when the stricture's length is very small. So the stricture length of 1 centimeter or less probably can be treated endoscopically with a procedure called internal urethrotomy, where we either use a very cold knife to cut the urethra and cut the stricture and dilate it, or we can also use laser nowadays to cut the stricture and dilate it. So many of them also get a bedside procedure done where we can do it bedside called urethral dilatation. But the chances of these procedures, the success rates would be little moderate because we tend to see high recurrences with these procedures in the long term. So longer segment of strictures are better treated with open surgery called urethroplasty, where we open the urethra, do a proper repair of the urethra by putting a segment of either a mucosa from inside the mouth or using the penile skin, and we will completely repair this stricture as part of the urethra so that the diameter would become as a normal urethra and patient wouldn't have any long-term issues with this procedure.
So generally, how much time or what is the recovery period of treatment after undergoing treatment for urethral stricture?
Okay. So patients who undergo the endoscopic procedures called internal urethrotomy, it's basically a daycare procedure. They go home the very same day, and they would probably have a urine catheter for 1 day or so, and after that we'll remove the catheter, and there is a small procedure which we teach them so that they can do daily, and this will prevent the recurrence of the stricture. So when we do an open surgery, they would probably have this urine catheter for 2 to 3 weeks, but they'll be discharged on the second or third day after the surgery. They can take rest at home, they can do their daily activities at home, but after 3 weeks, this urine catheter will be removed and they'll be reassessed about how they are passing urine, and then after that they are absolutely back to their normal life.
So are there any potential complications or risk associated with urethral stricture or treatment?
Yeah, so there are many complications associated with urethral strictures. First, I would like to tell some complications associated with urethral strictures. So any patient who is on long-term urethral stricture would tend to develop bladder contractility issues. They tend to develop recurrent infections, UTIs. They tend to develop kidney failure in the long run. So they tend to develop acute kidney injury, that is kidney failure on a short-term basis. And this would also in turn cause some dilatation of kidneys and lots of pressure changes over the kidneys. So these are all the complications which we see with urethral strictures. Urethral stricture treatment complications are very minimal. The endoscopic procedures hardly have any complications, and whereas the open procedures, the complication rates which we see are around 2 to 3%. Wound infection is one major complication which we see, and other than that there are any significant complications.
Can urethral stricture recur after the treatment as well?
Yeah, very well. Urethral stricture can recur very well. So usually the recurrence rates after an endoscopic procedures are around 50 to 60%. That's why we selectively choose patients who have to undergo an endoscopic procedure. And after the endoscopic procedure also, we would teach them a small technique to prevent recurrence called self-urethral dilatation with a small tube. So those who are regularly doing this, it would usually be very unlikely that they would develop any recurrence. Whereas when we do an open surgery or when we treat the long length urethral strictures with a definitive management of surgery, those patients very less likely recur. Less than 2 to 3% of them recur, if so, and if they recur also, they would take at least 15-20 years to recur.
How does a urethral stricture affect urinary function?
So yeah, urethral stricture, it's something like a phenomena of a motor and a pipe. When the pipe is blocked, the motor tends to run continuously and gets damaged. The same thing happens with urethral stricture. When there is a urethral stricture and the urine passage is blocked, there will be significant pressure on the bladder. The bladder tends to contract, but it can't pump out all the urine out. So this would cause a lot of back pressure changes, a lot of muscle thickening inside the bladder, and it will ultimately lead to a situation where it can't contract and it will fail. So this in turn causes some back pressure effects over the kidneys. Kidneys tend to dilate and the kidneys function keeps coming down. All this leads to repeated urine infections, kidney failure, some blood in the urine. So all these are the significant significant potential side effects which we see if there is a long-standing urethral stricture.
So last question, doctor. Can urethral strictures lead to other complications or health problems if left untreated?
Definitely. Urethral strictures, when left untreated, they cause significant bladder dysfunction. Even if after correction also, sometimes the bladder might not recover completely, and this can cause long-term symptoms like frequency, urgency, urge incontinence, and sometimes the bladder might not completely push out the urine. That is a condition called underactive bladder. So then again they need to go on to a technique where they need to drain the bladder every third hourly using a small tube, which we teach them. So along with this, there will be potential effects on the kidneys, causing kidney failure and dilatation of kidneys and repeated urine infections.
Okay, sir. So beside these questions, do you want to share your views or your expertise with our viewers?
Definitely. So I would like to tell the viewers that if any of you are suffering from any of these significant urine symptoms like frequency, narrow urine stream, urgency, any blood in the urine, significant pain in the lower part of your stomach or abdomen, or any dribbling of urine at the end of the stream, or you need to get it checked with a urologist. Go to your nearby urologist, get it checked, get it thoroughly evaluated so that you stay safe and your bladder and your urine system is healthy. So it can be very well treated. There is nothing to be worried about a urethral stricture. We can do it endoscopically or through open surgeries, but it is completely curable, and the recurrence rates are very, very low. So do consult and get yourself checked for it. Thank you.
Thank you, doctor, for your valuable time and your input. So we would like to conclude today's session with this, and we will see you next week with new episode. Till then, stay safe. Take care.
Thank you.